So look, with PRESBYOND, it's a pretty rigorous workup process. So when patients come to our clinic, they initially have a complimentary assessment with one of our optometrists. And then based on that, myself, so the surgeon will assess everything and we'll see if the initial assessment is suitable for them to go to the next stage. And suitability comes down to standard things for laser in general. So how like the anatomy of their eye. So is their cornea particularly thin? We look at, do they have a pre-existing cataract or lens change? Because obviously then they're not a good candidate for laser. We look at how dry the surface of the eye is. We look at their script. Is the script in a suitable range that the laser can give a really good outcome for? We look and see if they're going to be able to tolerate this laser blended vision, like if we think their brain is going to adapt adequately. And that's usually not an issue because 97% of patients do adapt. So that's usually not a major problem. But we do all of these things in our 1 to 1.5 hour assessment. So you can see it's pretty long. But we do all of these things to make sure that they're safe and they're going to get really good results from the PRESBYOND. So to answer your question, there are actually quite a lot of criteria that patients need to cross off. But when they do cross those off, we find that we're getting amazing results with our PRESBYOND. I think that's because, there's only a certain cohort of patients that are candidates for it.
Do you have any like special equipment that you use as part of your
Oh, of
assessment?
course. Yeah, yeah. So we have a pentacam, which is a corneal tomographer. So that looks at all the different parameters of the cornea, from thickness to how curved the front and how curved the back is, to looking at how much astigmatism there is. Then we're also very fortunate at Eagle Eyes to have an MS-39 and coupled with an Osiris. So the MS-39 is an OCT device that again looks at multiple parameters. So similar to the pentacam, it measures the corneal parameters, but also we can look at things like pupil size in the dark. So that's really important when you're doing laser, to make sure that pupils aren't too big so patients don't get side effects. And then we can also look at the cross section of the cornea. So instead of looking at the front and the back, we can look through the middle of it, and we can see if there's any pre-existing scars or any pre-existing damage. And then we can also look at the skin on the surface of the cornea and see if that's suitable for laser. So that's called epithelial OCT mapping. And then we have that in conjunction with the Osiris, which is essentially an aberrometer. So that looks at kind of visual distortions and things that you might naturally have that we can optimize. And that machine actually looks at the whole eye. So it looks at the front all the way through to the lens and to the back of the eye. And we're really lucky because the MS-39 and the Osiris are made in Italy. So they're pretty high-tech devices, and we find them pretty amazing. So we have those. And then we do a lot of other scans that assess the health of your eye. So one thing that I forgot to mention in my long-winded answer last time was that you need to have a very healthy eye to do laser. So you can't do laser or this treatment if you have pre-existing eye problems generally. I'm not talking about refractive error, but I'm talking about if you've had a previous retinal detachment or you have a macular hole or something like that, you may not be suitable, but it's still good to come in and have an assessment just to check your suitability, but they can be things that may exclude you from them.
Mm. What about certain like corneal irregularities, like keratoconus, for
Yeah.
example? Would that sort of would that kind of rule you out from
Yeah,
this
so for
procedure?
this procedure for PRESBYOND, anyone who has keratoconus or even features that are suggestive of keratoconus, so they might not have a frank diagnosis of keratoconus, but may have some things that are a bit concerning for a subclinical diagnosis. It's what we call form fruste keratoconus. So things like maybe their cornea is a little bit thin, or they have some steepening of the cornea where we don't like it to be. So lots of those scans that I was talking about actually looks for early signs of keratoconus, and this is an absolute contraindication for laser, not just for PRESBYOND, but for laser in general.
And you mentioned I think you mentioned dry eyes because like
Yeah,
that's a common problem, especially as
yeah,
people get older.
yeah, yeah.
So I'm wondering like how does like are dry eyes really a limiting factor for you treating patients, or is PRESBYOND actually maybe, a better alternative to some of the other treatment options?
Look, I don't know if it's a better alternative. I think we have very sophisticated technology that can detect dry eye in our clinic. So the MS-39, you have a staring contest with the machine, and it actually looks at the tear film. It measures the tear film breakup and the quality of the tear film. And then we have another few devices that we look at for dry eye. And I think that whilst PRESBYOND necessarily isn't better than other treatments, I think that to have laser in general or LASIK in general, you need to have good overall quality of your tear film, and you can't have severe dry eye because we all know that laser can exacerbate dry eye in the short term. So what we do at Eagle Eyes is we make sure that patients have a safe level of dry eye to proceed with laser. That's the first thing. But also if we do detect dry eye, we are able to pre-treat it so we can get you to a suitable level for undergoing laser, but then also for your recovery. So you're not having a horrible recovery where you're putting in an eye drop every 5 minutes, right? So it's about optimizing the eyes to make them safe for the laser, but also it's about working out kind of what type of dry eye and how we can treat it. Because we have also a dry eye spa on site. We have treatments like IPL and things that we can optimize patients with before laser if we need to, or afterwards. And if someone has very severe dry eye, it's generally a contraindication for laser. But I have patients with dry eye that I've, for example, initiated Icurvis or a cyclosporin treatment for, and then they've been able to go on to have laser. So it's, again, something that it's very hard to make a generalization about. You really do need to just get assessed by myself and my team to see if you're suitable, and we'll only proceed if we think it's safe.
That's cyclosporin, that's an eye drop, isn't it?
Yeah, sorry, it's an eye drop. So it's like an anti-inflammatory eye drop for the
Yeah.
eyes.
Yeah. And IPL, that's
And that's another type of laser. So not the lasers that we're talking about today, which is obviously the lasers on the surface of the eye, like I spoke about. IPL is a laser, basically usually around the orbital or around the eye that we use to target dry eye. And we're basically targeting the blood vessels around the eye to reduce the inflammatory mediators that are released. So it's a different type of laser. It's a surface facial laser, rather than the laser that we're talking about here mainly, which is obviously on the cornea.
right. So even if somebody, does have chronic dry eyes and they're thinking maybe, maybe I can't have this presbyon, potentially there are things that you could do to help somebody's eye condition
Definitely.
to bring them up to a point where
Yeah,
they would be good candidates for it.
potentially, yeah. So that we can generally optimize. As a general rule of, like, we can't make any general statements about whether they will or not be safe, but I do think it's still worthwhile. Even if someone's been told they have a diagnosis of dry eye, they should still be seen, because there's a huge range of dry eye, basically. Like there's a huge range of most conditions. And yeah, you just need to have a proper assessment to see your suitability.